Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. Each month, we select an article to feature as a press release with an accompanying podcast. Today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm really happy to be speaking with Dr. Cassandra Nguyen, who is the corresponding author for the article titled Culturally Informed Food Insecurity Screening, Evidence from the Northern Navajo Medical Center. I'm really glad to have you with us today. Cassandra, can you tell us a little bit about yourself?
Yes, thank you so much for having me. And my name, as you said, is Cassandra Nguyen. I am an assistant professor of cooperative extension at the University of California, Davis. I have a role that allows me to not only conduct applied research, but also ensure that that research and other important evidence-based practices are implemented through the cooperative extension system throughout the UC, as well as in partnership with other states and tribal nations in the US.
Thanks very much. And can you talk a little bit about the project that we're spending time today on? So a little bit about the methods and your results.
Absolutely. I think it might actually be helpful to start with some background that this project is a product of several years of conversation and collaboration with an incredible team of women who got together initially when I was still in Washington State. And one of my leads, Dr. Mandy Fretz, as well as Dr. Lydia Kim, who at the time was based at Northern Navajo Medical Center, were coming together to tackle this approach to understand if there was an alternative way that we could be screening for food security at the Northern Navajo Medical Center clinical sites. And what we did is we undertook a sequential exploratory mixed method study, which means simply that we took on a qualitative component, evaluated our results there, and used that to integrate into a quantitative effort to evaluate a new approach to addressing or measuring food security in contrast with the existing 2-item food security screener with clientele at the clinic. And this was in response to concerns that patients had been expressing to providers around the existing 2 questions that are asked related to food security in clinical settings that are very deficit based, oriented only on quantity of food, and can be stigmatizing for people to respond to. And getting into what we found, we were able to speak with several patients at the clinic and hear their experiences or what they witnessed in their community related to food insecurity, really demonstrating a widespread issue on or within their community. And they were really generous with their feedback, not only on the existing survey questions, but also on some new questions that we had drafted that were image-based and reflected traditional foods of Dene people on Navajo Nation, and provided their feedback to let us know which ones they felt more comfortable talking about with their providers and the context of those conversations with their providers. We took all of that feedback that we received in those qualitative interviews and were able to deploy a survey to just under 100 respondents in the clinic. And we were then able to quantitatively compare their responses to these new questions, of which there were 3, to the 2 questions that are currently being used and compare the responses. And initially we went into this with the hopes that these would be highly correlated and we could simply make the argument that these new questions could potentially be used in lieu of the existing questions, when in fact our quantitative statistics reflected that they were not highly related. I think the correlation was about 0.3. So there's some relationship, but it's not strong, and in no way are they potentially representing the same concept. And so when we reflected on these results, we were wondering if potentially they're getting at two separate concepts related to food security. And it's led to this larger reflection and consideration of whether or not it's appropriate to try to find something that's exactly synonymous to the existing questions, or to look at something that's more grounded in the community's conceptions of food security, and also how you might evaluate food security potentially at a community level to better respect community level experiences of food security versus an individual household, particularly in the context of programming and investment of resources.
Thanks. So you touched on this a little bit, but can you talk more specifically about why you focused on Northern Navajo Medical Center?
Absolutely. So part of our rationale for working with Northern Navajo Medical Center was because this responded to an observation and experiences that providers had, right? So these were clients that were expressing their concerns with the existing questions. And so to be responsive to those expressions of concern, we wanted to partner directly with them. And in addition to that, Northern Navajo Medical Center has previously had a fruit and vegetable prescription program in response to food insecurity in their community and among their clientele. So this is building on the momentum and the work that they've previously done to try to better address food security among their community members, because they know it's so foundational to health and well-being.
And then why was a culturally informed screening tool necessary?
Yeah, so the culturally informed aspect is important in a broad sense, right? That we understand that individuals' experiences of food security and the words that they might use to describe it and what makes sense to them might look different in different contexts. The specific foods that I would be looking for to be food secure might look different than somebody who is living on the Navajo Nation. And the approaches that I use to acquire those foods also might look different, particularly given the food access circumstances across the nation. The reservation is about the size of West Virginia. And if you look at the number of grocery stores or food retail outlets, particularly those that provide a variety of healthy foods, it's quite different than if you were to look at the same exact geographic space, right? For example, across an entire state. And so the circumstances look really different, and the questions that we ask about food security might need to adjust to reflect those circumstances. That's in addition to specifically thinking about the Native context and whether or not it was integrated into our development of the food security screening questions. And so the two item that's used, the hunger vital sign as it's referred to frequently, is based on the longer 18-item USDA Household Food Security Survey module, which was developed with really strong qualitative foundational work in the late 80s and early 90s. And that work was with women, mothers primarily, that were in low-income households, and the words that they used were integrated into the quantitative survey and really strong. Sorry, let me reiterate that. So the work that was done with women in low-income households that were primarily mothers was to integrate their descriptions of their circumstances of food insecurity into the questions that we ask. However, the women that were tapped for this work were primarily not Native, and also were now interviewed in the late 80s and early 90s, so we're looking at 30 plus years ago. And the words that were being used then may not be the words that we would be using now. And so that is reflective, or that is why it's worth considering reassessing the questions that we're asking.
Sure. Were you surprised at your results? And you talked about a smaller correlation. Did that surprise you?
It absolutely surprised me. And maybe I went in with some naivete, right? That my hope would be that we would do this grounded work and we would come up with this great solution that would be if we could directly replace the existing questions. But that didn't happen. And so that itself was not or that itself was surprising, and maybe it shouldn't have been looking at it in retrospect. That being said, I recognized that there was always going to be further work that was going to be needed to build on this. We did this work to adapt the questions to the Navajo Nation context, and specifically the context of Northern Navajo Medical Center. But we would have always, regardless of our results, had to then build on that with other communities in Navajo Nation, as well as potentially other settings in which IHS facilities are in. And so thinking about when we present the question about what foods individuals are eating, and we're presenting traditional foods, the foods on that plate are going to look really different for the Coast Salish people in Washington State, where I'm from, versus the Dene people in Navajo Nation, or the folks in the Great Plains area, where bison, for example, is more common. And so despite the fact that we had kind of surprising results, I think ultimately the next steps for us, our research team, and the larger area of work related to addressing Native American nutrition is in considering how we can have culturally rooted practices that reflect the diversity of Native peoples and tribal nations across the U.S. in a setting such as IHS that has facilities in all these places and could be really great partner in this work.
Thanks. I think we're all hopeful when we go in to do work with communities that we're able to develop everything just wonderfully. Sounds like you've learned some good lessons from this. And as you mentioned, you do have some plans to test the screener in other American Indian, Alaska Native communities.
Yeah, my hope would be to find some opportunities to look at how we might be able to partner with various communities and find a way of screening that reflects the diversity of traditional foods, but also allows for deployment in various settings. And so still trying to reflect and see what that might look like.
Well, I'm looking forward to it, and looking forward to reading about it when you get into it. Well, Cassandra, thanks very much for spending this time with me today. Is there anything else that you'd like to mention?
Absolutely. I really want to take a moment here to acknowledge not only the study team. As I mentioned, we were various women in various locations and from different disciplines, and I'm so grateful not only to Mandy Fretz at University of Washington, but also T. Benali, who is the first author for this work, who's also at University of Washington now, and Lydia Kim, who was at Northern Navajo Medical Center, but now is based in the Southern California area, Kelly Wilson-Begay, who is based in outside of Navajo Nation in like the larger Phoenix area, or at least at the time was, and then Priyanka Makadia, who is a provider still at Northern Navajo Medical Center. This would not be possible without the contributions of all of these independent individuals and their individual perspectives. And with that, I also would be remiss not to acknowledge the Navajo Nation for the opportunity to be guests and contribute to their community in this way, recognizing the efforts of the Navajo Nation Human Research Review Board and their efforts to ensure that research is done ethically and soundly to contribute to their community. So lastly, I also want to recognize that the various individuals who participated and provided their perspective. It's really not possible without individuals who are willing to participate in research like this for us to find these results and be able to build on it. So grateful for all the individuals who made this possible.
Sure, it's a big team effort. Well, thank you again for being here. And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months.